Welcome, future nurses, ready to test your knowledge on nursing delegation and management. Let's dive into 5 NCLEX style questions and see how you do. Question 2. The RN is planning care for a group of clients. Which task can be delegated to the LPN? A. Evaluate a client's response to IV morphine. B. Perform wound dressing changes for a stable client. C. Develop a teaching plan for a newly diagnosed diabetic client. D. Complete the admission assessment for a new client. Correct answer B. Perform wound dressing changes for a stable client. Rationale: LPNs can perform sterile procedures such as dressing changes on stable clients. Evaluations, assessments, and teaching plans are the RN's responsibility. Question 3. Which task is appropriate for the RN to assign to an experienced, unlicensed assistive personnel? A. Monitor a patient receiving a blood transfusion. B. Assist with ambulation of a post-op client. C. Administer an enema to a patient with heart failure. D. Teach a patient how to use a walker. Correct answer B. Assist with ambulation of a post-op client. Rationale: UAPs can assist stable patients with activities of daily living such as ambulation, blood transfusions, teaching, and any task requiring judgment or monitoring are not within their scope. Question 4. The RN is caring for a client with unstable vital signs. Which action by the nurse demonstrates appropriate delegation? A. Delegating client assessment to the UAP. B. Asking the UAP to obtain and report the latest vital signs. C. Telling the LPN to teach the client about blood pressure medications. D. Assigning the LPN to perform the client's head-to-toe assessment. Correct answer B. Asking the UAP to obtain and report the latest vital signs. Rationale: UAPs can take and report vital signs, but interpreting them and deciding the next steps remains the RN's responsibility. Question 5. A new nurse is learning how to prioritize client care. Which of the following clients should the nurse assess first? A. A client requesting pain medication. B. A client who needs assistance with toileting. C. A post-op client with oxygen saturation of 89%. D. A client who is scheduled for discharge. Correct answer C. A post-op client with oxygen saturation of 89%. Rationale: airway and oxygenation always take priority. This client may be experiencing hypoxia and needs immediate attention. Question 6. During shift assignment, which task would be appropriate for the RN to delegate to an LPN? A. Start a blood transfusion. B. Perform an initial assessment on a newly admitted client. C. Administer PO medications to a stable client. D. Teach a patient how to perform wound care at home. Correct answer C. Administer PO medications to a stable client. Rationale: LPNs can administer oral medications to stable clients. Blood transfusions, teaching, and initial assessments are the RN's duties. How did you do? Keep practicing and you'll be ready for the NCLEX in no time. Thanks for watching.